Well, welcome, Dr. Nicole Cammack and Dr. Danielle Busby. I am so thrilled and honored that you are going to share my platform with me today. I want you to use this platform and I want you to speak from your heart. And we've got a couple of questions, and let's just dive into this incredibly important conversation in this incredibly important time. So welcome to both of you.
Thank you. We're happy to be here.
Thank you.
Oh, no, it's so great. It's so great to be here. Okay, so can you just start by telling my listeners and viewers a little bit about yourselves and what you do and what keeps you motivated? Why do you do what you do?
Okay. I'll start out. I am Dr. Nicole Cammack. I am a licensed clinical psychologist, and I am the president of Black Mental Wellness Corporation. So we are a team of 4 licensed clinical psychologists, and we really got together because we wanted to make an impact on Black mental health and wellness. We really wanted to highlight the ways that mental health may sort of manifest and show itself differently in Black communities, deal with some of the issues that are specific to the Black community, and also just think about healing and all of those things. And so we're passionate about reducing that mental health stigma. So we want to make it relatable to people so that it doesn't seem like this scary thing. And then also we think that it's important to think about the next generation of mental health, behavioral health professionals and advocates. And so we started a national training program where we both mentor students in undergrad and graduate school for a year long, where they're assigned to one of our team members. And then we have an internship program. So we're very busy.
That's amazing. That's amazing. You're doing so much. That's incredible. Wow. Dr. Danielle?
Yeah, I think Nicole did a really good job of kind of explaining our purpose and our passion. But I think I just want to speak a little bit more to some of the reasons we personally started this. And I think just as professionals being in a clinical setting and seeing patients, I think we all started to see that among Black communities, a lot of times there was a lot of stigma around coming into treatment. And so a lot of times people were coming in way later in regard to severity. And so they were at a higher level of risk and had more problems in particular areas. And like, it really matched what we see in the data as it relates to disparity. And so that was just a concern for us. Like, we want to be able to help people get to the services they need sooner, right? So that we can have, less stress for those individuals. And so I think for all of us as providers, we saw that professionally, and that was something we really wanted to target. But we also saw it personally. Well, I saw it personally, just like within my own community, and seeing the different ways in which people cope, and seeking, formal treatment or professional treatment was not something that is as readily acceptable or is like a go-to first. So we really wanted to try to make the information that we give to people relatable, and we really want to be like the middleman between some of the jargon that exists in the mental health world. I even joke that sometimes it can feel like alphabet soup, right?
Oh
like
gosh,
PhD,
it's crazy.
MSW, LMSW, all these things. I think it's really hard for people to understand. So those were some of the reasons that we really were passionate about the work that we're doing. We're really excited to be here today. So thank you for having us.
Oh, no, I'm very excited too. And I'm so glad that you do what you do, because I've spent 38 years myself trying to help people understand the mind-brain connection and help people realize that emotions are very normal things, and that, the toxic issues that we are dealing with, that this is something all humans have. It's not some it out there. It's actually something that we all experience, and we need to be more, sort of level the playing field so that people can be more accepting and so on. And I know that it's culturally, there's a big difference. As you say, the Black community, it's been a huge stigma. It's a huge stigma everywhere, but it seems like it's even worse. So are you starting to make a breakthrough with your educational platform as well? Are you seeing change?
I like to think we're seeing change. I think that something that I've enjoyed seeing the last few years is just how openly people are talking about mental health in the Black community. So if you look on social media, it's not just these accounts associated with organizations, but there are people who are sharing their journeys. You have people talking about therapy and using terms appropriately, like calling it depression or anxiety or trauma. I think that you also see celebrities helping to normalize it. So every time someone is able to talk about their experience in therapy, how it helped them, how it changed them, that's breaking the stigma. And the fact that we can have these conversations and people aren't shying away from it, I am excited.
Yeah, I agree with you. Danielle, did you want to add to that?
Yeah, the additional things that I would add to that is that I definitely am also seeing change, and I'm seeing a openness from generations before that there wasn't a real openness around talking about mental health or mental health treatment. And so that definitely excites me. I think just through the work that Black Mental Wellness is doing and the range of partnerships that we've had, I think we're beginning to, really tackle that stigma even more. And so
that's amazing.
I don't think it's, a fix all everything.
No,
but
it's going to take time.
Think it's a step in the right direction.
Yeah,
Absolutely.
That's amazing. Well, that's especially in the current climate, which is an insane current climate, but it's also a good thing because there's an awareness created. And, I know as a neuroscientist that I've done years of research looking at the science of thought. So you can't change these non-conscious implicit biases unless you're consciously aware of them. So this conscious awareness that we're seeing now, we can't let it just be a blip and then go back. We have to accelerate. We have to make sure that we get that change, constantly climbing. So the more discussions that we have, and that's why we've made a decision as an organization to be an ally and to make our platform available to try and get this discussion out there. And we just got to help each other. We've got to, how do we, and that's, so there's a lot of questions around that I want to ask you. But my first question I want to ask you is, why has it been such a stigma in the Black community? I mean, I know it's across the globe, but it's why 60 years ago it was not like this in the white community. Then it became a stigma because of the way mental health has been managed and the narrative and everything around it. But specifically in the Black community, I've interviewed quite a few people now, and it's really an issue that you're just supposed to be strong and cope kind of thing. Well, why is it like that? What is the story behind this?
Okay, I was going to say, I think it's really important to situate that question in the correct context historically, right? And I think if we're honest, not even just mental health, but the health system in general, there are so many historical accounts of mistrust, of instances in which we create mistrust for people in the community. And I understand the mistrust. I mean, my own family members have a lot of the mistrust, and I am constantly, in conversation with them about, I understand, but this is how we can kind of have the skills and the knowledge with us to approach a mental health provider or approach a health system and see, is it a good fit for us?
Yeah.
Because there's been so many things that have created instances where, providers haven't always had people in the Black community's best interest at heart.
No.
And I think if we hold that at the same time and I need treatment, I can totally understand why someone would, try to find other sources before going to a more, traditional source of treatment. Yeah. And so I think that's one reason. Nicole, I'll let you hit on the next few.
I like that you're going to that historical context, because I think that shapes a lot of where we are today, right? And the interesting part that I think what's happening right now is it's sort of peeling back the layers that people from Black communities have already known and experienced, but it's showing it in every way. So for as much as we can say there's this historical context of why there's a stigma in the Black community, you think about the Tuskegee experiments. And I remember when I worked on a project with NIH, like after I finished undergrad, I did like this program, and we were in the communities in Baltimore, and they talked about like, oh, we were a part of these studies, and they came in and they like got what they needed and they left us. Or they felt accused, or just things that have happened historically. But for as much as we think about the historical factors, right? Think about healthcare now and the disparities in healthcare and how providers miss key components when it comes to Black people. So even thinking about our pain level, right? Like you're in pain and you explain this to a provider, and there are all of these false beliefs that, oh, because they're Black and they're strong, they can handle this pain, or, like coming in. And so even in my work, I work with veterans currently, but just feeling like I've tried to talk to someone in the past and my feelings were minimized, or I was made to feel like I was crazy, or it wasn't validated in a way that I needed. And so people start to also build up these negative beliefs about mental health professionals. And I feel like that's part of what one of my number one goals with Black Mental Wellness was how do we change what the face of mental health looks like? So again, it doesn't feel scary. So if you see someone who looks like you, who can talk like you, who can speak to your experiences, then will that help? And I understand that you can't can't just be like, oh, only go to a Black provider, but maybe there are providers who are culturally competent and who are bringing these issues up in sessions so that you feel like you're being heard and validated and really make that change.
It sounds like a vital component. Go ahead.
I just wanted to also add, I think there's an idea or mantra, not even just a mantra, but like there's a spirit within the Black community. I think sometimes that you are, at least generationally, previously, where you've kind of been taught to keep things private and you've been taught to keep things in-house. And that could be your immediate family member. That may even extend sometimes to your like religious institution or the church that you attend. But like beyond those particular entities, I think sometimes it's taboo really to talk to someone else or let someone else in on what's going on, given just not even just medical mistrust, but general mistrust that may be present for people.
And I want to add to that.
Yeah, please go ahead.
Factors that when I first thought about we need this organization that sort of drove it is that in the Black community, because of what we've been through as a people, right? There's a lot of value placed on being strong. And I want to shift that narrative of strong doesn't mean you don't attend to your health or you have to suffer or you have to endure things. But that's what happens. So, you always hear about the strong Black woman. I think when people see you, and it happens to me, people see the challenges or the things that I'm taking on at work, they don't say oh, I should help you. It's you're so strong. And so that makes it more difficult to break through those barriers and say, I need help. Because people aren't even seeing you as a person at that point. They're seeing you as this superhero. And so I've heard that in therapy where Black women have said, I sat in the chair and my therapist said, but you're so strong. And I think that people see that as a compliment, but in a lot of ways it can be defeating because it's even in this setting, I have to put on this front like I'm okay.
That's exhausting.
It's so exhausting. And so what ends up happening, as you said, Danielle, is that by the time people come in for therapy, Black people specifically, a lot of times the symptoms are so much more severe. It's not only did I have this trauma, but I started drinking. I started using substances. I lost my job. My wife left me. And now I'm seeking help because at this point, I've tried to handle it all on my own. So if we can educate people to come in sooner, hopefully that too can prevent some of those other consequences of not having that care.
So it's those perceptions and those labels and those perceptions of what a Black woman is or a Black man is or what that limits people. Those labels lock people in, and it's kind of defining someone. You're putting a definition on someone that's not true. And then there's a value attached to it. So people can't express themselves. So I've got to be strong. So I can't cry, or I can't say I'm tired, or I can't say I'm feeling this today because of this situation, because you're kind of not allowed to. You're not getting permission.
You're not getting permission
to feel that. But we've got to give ourselves, we've got to have that compassion for ourselves and with each other to give ourselves permission to feel and to express those feelings and describe them. And that hasn't been happening.
You're exactly right, because I think about Black men as well. We talked about women, but this idea that masculinity is based on not having emotions, right?
Oh, gosh, it's so insane, isn't it?
You can't express emotion.
As a human, you can't not have an emotion. Seriously?
You're in this field, right? It's what do you mean? We're human. So of course you have emotions, and that is healthy to express those emotions. But most importantly, feeling safe to be able to do that without having your identity, your manhood, your womanhood, your role as a mother, your role as a wife questioned because you're having those emotions. Yeah.
Wow, so it's almost like redefinitions are needed, and that's a lot of education. It's a lot of discussion. It's a lot of taking away these perceptions and redefining them. seeing them differently. It's so interesting. Some of the research that I've done is looking at the science of thought, which is part of in the mind and the unconscious mind, and how implicit biases form and how habits form and that kind of thing, which goes so much to the current, the white privilege and the things that we don't even know are in our unconscious mind. And then to all of us, our cultural upbringing and everything, we've got all this driving us. We just have to get it all out and we have to start changing it. But what I wanted to mention about the emotion side is that thoughts are real things. They're not just they're concepts that are real, but they're in your brain and they occupy mental state. They even look like trees in your brain. This has been years trying to teach people this. And a thought's got emotions and information and physical reactions. So, and that's every human. So how can we say because you have a black skin and you're a black woman that you don't have emotions because you're a human with thoughts? And so this is what I'm trying to do with my work, is say, hey, listen, humans have thoughts. This is what a thought is. And if you don't deal with it, it causes brain damage. And if you have toxic issues, this is going to be causing. So if you're actually racist and you have racist issues, or you've got non-conscious implicit biases that you don't even know, you've got to do the work of finding them because of your cultural belief, because they're actually damaging your own brain. So, and then it damages relationships. So, I just throw that in there to reinforce that we have to stop. We've got to redefine things, don't we? It's almost like we have to redefine so many basic principles.
Right. And if you can do that work within yourself as a provider, as a white provider too, as you're working with people of different cultures, being able to see them as human first. And being able to understand these historical things, these, situational experiences, how systemic racism is, how that all impacts what you're seeing in the room, then you're really making a change.
Then you can make a change.
What you're feeling, you're ignoring what's happening in the world. What you're also doing is you're contributing to what that person is feeling, because in that room and in that space, they're not being seen.
They're not being seen. In South Africa, there's a term, a greeting that says sawubona, and it means I see you. And so it honors the value in a person. And I was just interviewing another person just earlier on, and she's also from South Africa. And we were discussing this term that it's sawubona. It's such a beautiful thing because it's I see you. And a lot of the work I've done is you first look at the person, not whether they're male, female, whatever, it's you look at you, I see you, and that's something that I think as humans now we've got to reach the point in humanity where we start seeing each other.
I totally agree. And I think the work, like how you mentioned implicit bias earlier, I think that's going to be so important for people to, do the work to become aware of what are their implicit biases and how they're impacting not just the work they do, but like how they're interacting with people on the daily. And so I think you make some really strong points there.
That's really it. I think it's really important. Well, why do you think it's important to include race in conversation about mental health and wellness? Because as a society, not just as individuals coming in for therapy, but societal. Let's go with what's happening at the moment. Mm-hmm. Who wants to go first?
I was waiting to see. Okay, I'll start. You ready? Okay. Yeah. I think, taking into context everything that we've already talked about, and I'll be honest, I was also excited to hear that as people were talking about what's happening now, that Black mental health came up as part of that process.
So excited.
Because it's like, people are getting it in a way that feels like they're getting it at a deeper and more authentic level than they have previously. But you can't talk about Black people in America without thinking about the impact that being in America, like historically on through, how that has impacted our mental health. So
you can't separate that.
You can't separate it. And it's in like the smallest things, just thinking about, we know the origins of coming from being taken from different countries in Africa, and you're taken from this foreign land. You go through the ocean and you're stacked up in this ship, and then you're taken somewhere to this foreign land. If you survived that part, right?
Yeah.
And you get here and you're treated like animals. You're forced to, give free labor, and you're enduring abuse, and you're being separated from your family. And that's like, as a mother, I could not think about birthing my child and at some point someone selling her and separating us. But this is what happened to Black people in America for years. And it's the ugly part of our fabric that people don't want to discuss, having to fight and, identify ways to break away and escape for freedom. And I'm saying all of that to say, we know that in other populations, when they look at the transmission of trauma, right? And you look at it across generations and you see how trauma is passed down, even generations away from where the traumatic experience happened. Now, I think about slavery in the same way that I explain it to my veterans. You're being flooded every day, every night with trauma. The fear of what will happen. Think about what that does to you mentally, what it does to how we think about family, how we think about relationships, how you connect, how you hold on to your children because you don't know what's going to happen. And then you think about, now I am having, generations later, I'm sure if they studied it, it's still there.
So it is. That's epigenetics. I'm so sorry to interrupt you, but that's one of the areas that I work in, and it passes through 4 generations. It actually keeps going. I mean, it's constant. It's there. It's inside of us. So whatever you experience, whatever thought you grow in your brain, that is going to pass through the sperm and the ova to the next generations. And there's so much research supporting that. So you have got the kids being born today have got that in their psyche. It's there.
And I explained it to my daughter, goes to a school that's very different from how I grew up. And they're very free when it comes to like staying overnight and letting them go. And we have like a diversity, equity, and inclusion group. And one of the things I talked about is like, I have to evaluate, like, why am I like this as a parent? Like even that fear when we're in public, I hold on to her tight. It's like, I can't let you out of my eyesight because I don't know what might happen to you. Nothing's ever happened to you. Nothing's ever happened to her, but that was how I was parented. Yeah. That's how my mother was parented. It's sort of like just passed down. So all of these things impact our psyche, how you relate to the world, how you see yourself in the world, how you relate to other people, how you have to navigate microaggressions, how you see things happening and you don't have power to change it. And then if we bring it to present day with George Floyd, I feel like it was a catalyst of what's been there. It was
the explosion. The volcano exploded.
I can't take it anymore. And so if you as a provider, like, just thinking what that does to people, but then if you think as a provider in the therapy room, how can you meet with someone and not think about them within these contexts and at least figure out what it means for them?
But that's good mental health. I mean, that is proper mental health. When I do my clinical trials, we look at a case study, an individual within their narrative. The most important part of my research is the person's narrative and their context. And if you don't consider that, you can't measure a person, because, the whole move with research, even in psychology, psychiatry, etc., is not done properly. It's done with the numbers. You're not a number. You're an individual with an individual story, and we have to look at narrative and context within each person. And it's so logical, but it's not being applied, is it?
Not.
Dr. Danielle.
I wanted to add. I'm sorry. Yeah, I wanted to add that. I think when the question you asked about like why is it important for us to be having this conversation about like mental health, about wellness, largely. And I think I'm happy to see that this conversation is starting to happen, but I think we need to start having this conversation in the context of health overall. I think a lot of times I think this is really important because not just because we need to talk about mental health specifically, but because your mental health is going to directly impact your physical health. If we look at disparity around different health conditions, and if we were looking at differences by race, like we see very clear indicators that certain groups of people have higher rates of X, Y, and Z compared to others. And I can't help but make that link in that because certain groups of people, particularly Black Americans, are experiencing so many ranges of stressors in this country. Some related to race, some related to SES, some related to not really being integrated within these larger systems or being considered in these larger systems. And that naturally is going to impact how well we are physically, right? And that's also, you know what I mean? How well you are approaching your mental health and wellness is going to directly impact how physically you're doing. And so I think understanding that, like you said, like that mind-body connection is so important for all people, but I think it's particularly important for Black people in the US.
So glad you raised
world.
that. No, I'm so glad you raised that point because it is so significant. The research I do is mind-body connection, and we just see, like, we have to see a level of stress that is whatever level of stress immediately. For example, I'll give you one simple example just to emphasize how we have to look at disparity and we have to look at health is if you are under constant toxic stress and not managing it. So this coming through the generations, worrying about getting in the car and a policeman stops you, going to a takeout place and you walk in and they look at the white person this way and the black person that. I've got 2 black son-in-laws and they tell me this. They'll get in, my son and daughter are married to black people and they'll go into the same restaurant. They'll look at their husbands differently to what they look at them. That stress. Now I know from my research, and it's not just my research, there's a lot of others, but my most recent clinical trial showed that there's a significant link between that kind of constant living under that kind of pressure and toxic stress to, for example, dementia, to cardiovascular issues, so getting dementias in like your 50s and 40s, which is what we're seeing. People dying of cardiovascular. Now we know in the Black community that there's a massive increase in early identified dementias and cardiovascular issues. So we see a direct raise in, for example, homocysteine levels under that kind of stress, which immediately puts you at risk for those. But if you control it, another thing, telomeres, your DNA, the actual telomeres, which are the little caps on the ends of the chromosomes, those things shrink significantly under toxic stress. In other words, you age, your cellular aging. So we saw people under extreme stress they were like their biological age was 20 years older than their chronological age. So now I'm thinking, okay, so if this is what people are experiencing, now we translate that into a constant state of stress that the Black community is living under because of racism and et cetera, and the whole everything that we know. This is the risk. This is why. We can't ignore this. We have to do something about it. So I'm really glad you raised. I mean, I get so passionate about this because it's just got to change, and the evidence is there. Look at COVID. Who's getting hit the worst?
But people ignore it and they don't see it as evidence and they don't see the ways that they are contributing to what's happening. So I work in a primary care setting and you see the Black patients, they're like disproportionately dealing with like dialysis and they're like you said, young. It's like how? Or, you have diabetes or high blood pressure and all of these things. And it's interesting because what primary care providers are starting to refer them to is like, oh, you should go to, we have like this whole health where they can do meditation and yoga and acupuncture and all of these ways. So it's all about how do we bring the stress down. But I think systemically, we have to look at how all of these different systems have been impacted by racism and disproportionately impacting Black
you have to find the origin, don't we? We can't just put a Band-Aid on the wound. So yes, we need all of those techniques because you've got to help people cope in the situation. But it doesn't mean we don't pull out the root. We have to still.
Right. So you look at the communities, you look at jobs, you look at hiring practices, you look at pay differentials, you look at, did I say school systems? Because that's important, right?
That's huge.
You did.
You look at that. It's just like all of these factors. And it's like you're fighting through life, essentially. That's heavy. It's heavy.
That's terrible.
So, yeah.
To live with that. So that is really, it's not like, oh, why does the Black community die younger or have more? It's because of what we've done. It's systemic racism that has created you can't live under constant pressure and not have a consequence because your mind moves through your body and your brain. Your mind and brain are separate but inseparable. So obviously the extent of the mind pressure is going to reflect in the brain and the body. And that's why we have to keep this in conscious awareness. We have to do everything we can to keep this in conscious awareness now so that we don't go back and just have a little shift and go back and have a little shift. You've got to, up the shift. Yeah, we have to keep going. So, okay, so there's so many questions I want to ask you. Okay, the how can we help support? How can like what can we do to support? How can we help support Black mental health? What is something that a lot of white people are listening to this? What can they do to help?
I think step one is just what we're doing right here is having
education.
Because through this, you can get the education, and then you can start to have those, sort of internal conversations with yourself about where are those areas that I need to grow a little more and I need to learn more, or what are some ways that I can improve how I think, what I do to change the systems that I'm in. What can I, like you just start to think about it differently. If we're all being honest, you can have those clear steps of this is where I can make an impact. I can directly change, my hiring practices. I can make sure that I diversify the leadership in my company. I can make sure that the education in the school system reflects the total school and the truth of the children that are in there and not just one population. We can make sure that we're providing access to care and for quality care, and making sure that people have access to it and can afford the mental health treatment that they need. We can fund small businesses. We can fund organizations that are out here doing the community work, where they will connect providers to those who need them. There's community programming. We think about budgets. It's like so many ways that
ways.
So I know like people are like feeling like, oh, where do we even start? But we all need to start somewhere because the system targeted from different sort of standpoints.
Well, we made a decision that, sorry, go ahead. No, go ahead, Danielle.
I was just going to add, I just think it's so important for people to figure out what their lane is going to be. So I think a lot of times when we're having these discussions, it feels overwhelming because you're thinking about all the different ways you can begin to do the work. And I think really figuring out what is my skill set, what do I offer, what is a strong point for me, and then like taking that lane and making it your charge in whatever particular way that's going to address like these larger systemic issues. And I think a lot of times we think about how can I do this one thing, or how can I have this one group come in and talk to us, but like, how can we integrate it, right? Like, how can this really be about a part of the fabric of the work you do and not an add-on? Because I think that experience
that's key,
is part of
not an add-on, but part of the fabric.
Right, we're a part of the fabric because we've been a part of the fabric, right? Like for years, and we haven't always felt that we were. And I think if people can be intentional about like, how do I truly integrate these ideals, these principles into the work that I do, we'll see greater change. And I think people will be more personally connected to the things that they're doing, and it'll be a part across their system. It's not just this thing I need to do to check off my list. And not that I'm saying everyone does that, but I'm saying in general, if we really want to embody the things we're talking about, we're going to have to make it bigger than the month of February or Minority Mental Health Month, or, these things that make you think about particular groups. So that would be my addition.
I love that. So if I take what you both said, it's a situation of educate, which is what we've chosen to. I don't know if you see on our social media platform what we've decided. We've chosen to educate people, be an ally. We don't have to. We can. There's so much out there because there's movies, there's books, whatever. So there is. We're doing a challenge. I'm doing a challenge with Michelle Williams over the next from 22nd to 21 days, where we're going to detox our minds to detox society. So we're going to try and help people to have the courage to dig deep and find that systemic implicit biases you don't think you have, but they're there, to the point of, like just as you say, that are you looking at your Black employees differently to your white employees? Why do we, it's not like an add-on. I love that you said it's not an add-on, it's a fabric. So we can take what you said and we can actually say, okay, well, this is how the company runs, or this is how the organization runs, or this is how whatever runs. Is it the same for all humans, or am I making a difference? Is there a difference between how you treat whites and how you're treating Blacks? It's those basic things that we could educate and stand back and look at how things are actually being run right at the level of how the fabric is being weaved together. And if we do that as a conversation, where it takes courage and it's going to take a lot of looking inside of ourselves, but that's how we grow. That's what humans are supposed to do anyway. And we can do it together. It's not like we're doing it alone. We can do it together. We can come alongside and do that together. But now, in terms of you wrote a phenomenal article that you contributed to for HuffPost, and I love it. And it's something that we're going to put the link on the show notes, and I want everyone to read it, because you also you give a lot of advice there about how to just listen. I love that. Can you talk about that as well? And the validation of what you're going through, etc. Because we can't. I grew up in South Africa. I saw apartheid, but it doesn't. And I worked for 25 years in the pre-transition and the post-apartheid era, and I saw the effects of racism. But I could go home at night as a white woman, even though I was in the community and my husband was building houses and whatever. I was in education and mental health, but I could go home at night. So I cannot understand. I just saw the effects, and it was horrific. So how do we listen properly and get that empathy that we need? Because empathy will drive the action. It will keep things in the forefront of our heads that we do stuff.
Yeah, I like that. I think it's just what you said, like in part of listening, it's not listening to, I think sometimes what happens in this conversation is, if I as a Black woman share my experience, and I'm sharing it with a white woman, they may take like ownership or have guilt or have other things get in the way or try to justify or minimize. And maybe that's some of that discomfort that you're experiencing. And it is going to be a very uncomfortable discussion because it's uncomfortable being a Black person in America for many people. It's uncomfortable living through a lot of the experiences that we have. And so I think when you listen, it's just listening to, again, see that person, to hear that person, to listen without judgment, to listen without trying to justify or explain away, but really to understand if I can hear you and if I can see you, then maybe I can understand what your experiences are like. I can understand that, what you're going through, how it impacts you. And then I can start to realize, wow, this is how big this problem really is. And here are some ways that I can be a part of changing that. And so listening really provides that sort of safe space and shows that you are interested, you care, you're aligning with that person, you see that person is important and what they're experiencing is important. But most importantly is you're learning. Because I feel like for so long, experiences have been things that have been shared among the Black community, but other people may or may not be privy to it or may not have to, I shouldn't say privy, they haven't had to deal with it. And that's where you have the privilege of not dealing with this. For Black families, you don't get that privilege. How we raise our children, how we communicate to each other, how we act in public, how we carry ourselves at work, how we, stay safe in places where you don't know, is it okay to be here? I grew up in Virginia, and there are places that you go, 30, 40 minutes outside of Richmond, and it's like, this doesn't seem like a place for Black people. I have to think about that.
Wow.
So I think listening.
We need to hear that. We need to hear that. We need to feel that.
I totally agree with Nicole from the standpoint of like listening is so important and really making space for someone to truly share their experience in a way that you're not justifying. You're not trying to like work through your own stuff in that process. But I also think to proactively take your own steps in educating yourself is also really important, because I think what happens a lot of times in the Black community, I feel like for the Black community, you feel the pressure of other people to ask you to educate them on
that's
the
too much,
experience.
yeah.
And while we want to, of course, share our experiences to whatever degree, it's still a lot of pressure involved in that. So the ways in which you can do your own work, like the webs, like going on Google
and the books and the movies, there's no excuse for resources here.
Right, like there's tons of ways in which you can kind of like do that work. And I think coming to someone when you're listening to, even, you don't have to showcase you've done the work, but kind of acknowledge like, this isn't for you to teach me everything. These are kind of the steps I'm taking. And so do that for yourself. Like, what steps am I taking? Am I leaning on individuals only to educate me on certain experiences or just to learn from? Or am I taking proactive steps to genuinely model, not just for like youth, but for my peers or whatever, that this is how you proactively take the steps to do better? And you don't, and to accept you're not going to do it perfect, but you're making that intentional effort and you're doing that intentional work. I think it's also what's really important.
That's really, I love that. Go ahead.
Add to that too, is like when we're in these spaces, and again, I want to emphasize that just because you get to a certain level or you have a certain education, it doesn't mean that these experiences aren't still there. So
that's very good.
As a licensed clinical psychologist, I have to fight and work twice as hard to prove why I am in a room. And I get questioned by people in ways that people with less degrees or education or experiences do not. The other thing that comes up is that when we're in spaces like this and we're having these discussions, the ownership, the responsibility, the idea of even discussing oftentimes fall on Black people or people of color, right? So if I think about my job, and if we're thinking about diversity issues, every time I go to a diversity committee meeting, it's head by a Black person. The attendees are Black, Indian, Asian, LGBTQ.
Where's the whites?
Where? And then it's like we're always the ones in the room discussing it. So something as easy as like, join the committee.
Yeah.
A lot of professional organizations have a diversity subcommittee. Join. Be a part of that. Bring up the discussions yourself, even if you don't always have all the answers, because we don't have all the answers either. But that's a perfect way of showing, I'm going to share this with you. I think this is important too. And I think that it's sort of, if one person opens up and talk about it, it sort of like opens it up for other people as well, where it's like, maybe we do need to talk about this, or I need to, think about these things, because there have been people who have said, I haven't been trained like this. I don't know how to do this work. And it's like, well, you don't get the luxury. Again, that's that privilege. You have to educate.
That's the privilege. Mm-hmm. So if we don't listen, we don't know. So you just have to listen and hear and be part of these committees, be part of these conversations. We need to be having these conversations. We need to hear, and then we need to educate ourselves. And then when you listen and you understand, how do we ever understand that unless you are in it? But because you can never be an expert on someone else's experience, but you can certainly have the empathy and share through listening to that person. And then you can educate yourself, and then you can find your lane. This is what I'm summarizing what you've said. And you can find your lane, and you can actually do something. So get the shock, listen, hear the pain. Then, hear the pain, educate, and get your lane. Hear the pain, educate, get your lane. We do that together, and we can start moving forward. Mm-hmm. It's like, it's there. It's just, and to have what do you need to say? What more do you need to say? Take this away. You lead this now. Say what you need to say. Share.
Nicole, before you jump into additional things, I just wanted to make one more comment.
Please do.
And I totally agree with much of the summary that you gave, but I think it's important for us to hold the fact that in this country, Black Americans have been through, yes, a lot of pain, but at the same time, without giving this narrative of strong Black man, strong Black woman, but at the same time acknowledging and accept there are so many stories of resilience, so many stories of joy, and it's not all. I have a desire to come from a more strength-based model, and that there are definitely things that we need to work on, but there are so many strengths that we already hold within our culture and within our way of being. And so I just don't want. I've never liked to paint the story as all pain, but I think for all people to hold both at the same time is really important, and I think it humanizes us in really real ways.
I love that, because then you see the resilience in humanity to overcome adversity, and how we know all the research. I mean, you girls are totally educated. You're both doctors. You know that adversity will breed resilience. So that's what you're saying, Dr. Danielle, is actually to understand that adversity has also shown a level of resilience that's also educational for others. I love that, to focus not just on the negative, but on the positive that's come from adversity.
Mm-hmm. I think that's the core of Black people, right? We're going to find a way to unite, to find the joy in life, to connect to people, to dance, to sing, we're a community in so many ways. And maybe part of that humanity is not for us to know, because we know that about ourselves. We know that about Black people. It's just like this aura that we have when we're around each other. Right? I think people need to see us in that way. And that we are full beings. And if Black people in America are able to still have the joy and the family, the spirituality, the core values, to be able to maintain a family despite those times when families were ripped apart, and you're still doing that and smiling and laughing and being, finding That's unreal. Like imagine if there were true support and changes in a lot of these systemic things. So I think that's the beautiful thing about Black culture is that we find that joy despite the pain, but that pain doesn't hurt. So
that joy in community, I love that. That's really amazing. You know, in quantum physics, there's a principle. Quantum physics is called the science of thought, basically. And there's one quantum physicist who always says it's not about you, it's about you in the world. You know, and that's kind of what you've just said. And if we can just, you know, the you is everyone. But at the moment, everyone isn't being considered. My son-in-law was using the example of, there's been this whole thing when people say Black Lives Matter and then everyone's responded with All Lives Matter. And I mean, we had so many people climbing into us and unfolding us and getting mad and saying God doesn't see different color is an honoring thing. It's so important to actually see color because diversity is so beautiful. There's no value. There shouldn't be value judgments in difference. And my son-in-law was saying that it's like an emergency room where everyone needs attention. Everyone's there in the doctor's room. And then someone comes in bleeding and they're on an ambulance, obviously they're going to get attention. So that analogy's been used quite a lot across social media. And that's what we have to do. We have to look at, in order for us to be human, we have to address what's bleeding. You know, and so we have to focus on that. So you have to look at that and you have to see that and what's wrong with that and why they're bleeding and how can we fix it and what can we do to prevent that happening again and that kind of stuff. So I don't know, just as sort of an analogy that pops in my head at this stage. It's coming back to that being decent humans.
For sure. I just did I made commentary on a parenting.com article and they were asking me about tips to share about how to raise like a racially conscious child, right? And I think the one part of what you said about it's so important to celebrate and to acknowledge difference in how people are unique versus this idea of let's all just be the same, let's make us one thing. Like I think that's the traditional ideal that people think we're seeking. But in that same way, when you talked about the greeting being I see you, when you tell me that we're all the same, but I'm looking at such a very obvious difference, and we just sat here and talked about all the systematic problems that look different for different groups of people, I don't feel seen, right? Like I can't feel seen if you're telling me I'm the same. And so while I appreciate the sentiments around the idea of this collective unity or this collective race, I think it can be very dismissive of
I agree with
very key things that are important to anybody about who they are and where they come from.
I mean, one of the deepest things that people say, you know, the work that I've done, when my patients would come to me, one of the first core things I'd have to work on would be identity and that value that was shot. I mean, people's identities were shot. And if you don't have your identity, you don't want to live. And I know you work, Dr. Danielle, with suicide. You've done some stuff with suicide prevention and that kind of thing. And I've done some work in that area too. And the first thing is identity. If you don't feel, no one wants to be seen as just, oh, I'm like everyone else. It's the most basic human thing that people will say, this is how I see it. I mean, how many times do you do it within your own family where you'll turn to your husband or your wife or your kids or, you know, let me say my say. This is how I see it. We want to be seen. So if that basic thing is there, we've got to acknowledge the beauty of the different races and the cultures. It's incredible because each one is enhancing. I don't like competition. I like enhancement. And I believe that our society needs to shift towards a philosophy of enhancement because enhancement, I see you. And I see you not as a threat. I see you as something, I see your culture, your belief system, whatever, as something that enhances mine, not threatens. But whereas competition implies threat, enhancement implies that I see the value and I can learn from and that's how the science shows as well, the quantum physics, also all of the neuroscience. When we enhance, we grow, we improve. As soon as you are jealous or envious or judging or putting a value difference, you actually cause brain damage. You know, we told people this message, every time you judge someone or you don't celebrate someone for I see you, the Sawubona concept, you're causing brain damage in your own brain. And I'm thinking maybe that's how to get people's attention is like, do you want some brain damage? Well, then judge someone, you know?
I love that. I didn't know
and then
that.
If you take a lifetime of judgment, that's even worse. So
exactly.
I agree.
Yeah.
In seeing our differences, it's like you said, for as much as we're different, it allows for a deeper level of connection. So when I can learn about your culture, your experiences, your values, then it's like, oh, wow. And then it's interesting because for as much as we're different, I joked with my friend, she's like, I want to buy, can I send you dinner? I'm Jewish. This is what we do. And I'm like, that's what Southern Black people do. You send food whenever something happens. And it's just about
the commonalities as well.
And it's like, if we can see that, then we see where we're different, but also different ways that we can make connections and truly like understand each other. That this is us, Black, white, Latina, Asian. It's like, oh, we're a people. We're human.
We're a people.
How express that, right?
And each different color in race is going to enhance each other. And that's exactly what the brain science does. If you celebrate someone else, you actually improve brain health dramatically. Your brain looks different. So that means your decision of your mind is going to bring brain health into your brain and your body collectively, and changes your hormones. It changes the homocysteine levels. It changes your telomeres. I mean, these are like really basic scientific facts that need to be, I believe, this is from my angle, need to be added to the discussion on race. Is we need to bring in these very strong scientific factors, that we don't separate out the psychology from the impact that it's having on our biology and the importance of enhancement. Gosh, this is okay. Danielle, tell us a little bit about your work with. I know that because I was reading here about that you look at Black college students who are at an elevated risk for suicide.
Yeah, absolutely. So I received an NIMH Diversity Supplement grant, which is during my postdoctoral year at University of Michigan. I worked with Dr. Cheryl King there, and she's a leader in a lot of suicide prevention work around adolescents. But I really wanted to look at college students in particular. I think that's a very unique developmental period. I think that's a time that a lot of transitions are happening around identity and around change. And I was really interested in understanding for the Black college students in particular, like what are the things that get in the way of seeking services. So it's actually the top finding we found was that it's perceived need. There's it's a general consensus within students is that like I don't think it's that bad. Like we've kind of been through a lot of tough things and we've had a lot of tough experiences already. So whatever mental health risk factors I may be experiencing right now, and these are all people who are at elevated risk for suicide. And so that means they either screened for a past suicide attempt, they had a high depression indicator, or some sort of substance abuse past or current. And so these are people that are already exhibiting higher rates of risk. And even in that, this group in particular is saying that they don't really perceive a need for treatment. And I think that just kind of aligns with much of the work that we do with Black mental wellness, in that even when symptoms are present, even when resources sometimes are present, because on a college campus, most times there are like some sort of free, it's mostly a limited number of services.
Yeah.
But I was trying to think about how do we control for that access issue, right? And I think about a college campus in that way, because at least you can go to the local college counseling center, and to know that those students are still not seeking services despite their high risk was just a really big concern for me. And in general, I want to do work that's going to help eliminate barriers for, Black individuals, but honestly, people that have this elevated risk. When we talk about trauma, when we talk about suicide risk, like those are the groups of people that I think need the help the most, and oftentimes are the groups of people that are the last to receive the help, or are the last to even go about attempting, right, to receive services. So that project, that was kind of like the focus of the project, to understand suicide risk more globally. I have some other articles that I wrote that kind of looked at that intersection of not just race. I think we talk about ourselves around identity in an isolated way, like I'm a Black American, or I'm a woman, or, I identify with group. And I think the truth is that no one person is coming into a space as one thing, right? We're coming as a collective of everything that we are. And so this work was looking at the intersection of race and identifying as someone that identifies as LGBTQ, and thinking about see differences in that way. And so that was kind of the area of that project. I still have a high interest in suicide risk and intervention and treatment. At my current position now, I'm developing a clinic that's specific to depression and this kind of like suicide risk piece of things.
Wow. And did you find that in your research that there's a higher risk for suicide amongst Black college students than white, or is it kind of the same, or is it the treatment access? What are the variables?
So in that study, I only looked at the Black college students. So it wasn't about comparing it to other races. And I think sometimes that's another thing in research. I think a lot of times there's a lot of work that's done at like looking across race differences, and we identify that they're there. But I think there needs to also be more work about really understanding the experience, the unique experience of Black students or Black people in general, and understanding the diversity of the Black community. I think we all think a lot of times that, you know, the Black community is one way, but like within our community, there's so many different variations that I think make us such an awesome culture. And when we say Black, we can be talking about Caribbean, like someone that comes from the Caribbean, someone whose family has immigrated from the continent of Africa. And I just think when you look at one group and its totality, and not just like, let me box you so you're
not going to get the correct results. No.
I think we get more rich data. And now you talked about, like, I start with a narrative in all my family, in all my patients or my case studies. I think that's important for us to do, not just as individuals, but in the research sector of things, like really working in that way.
You know, I love that what you've just said, because if you look at the individual case study, then you're measuring a person against themselves. You're not measuring them against something else. And so you look within the context of a case study. So and that's also how I've done my research. We've done because you've got to have a certain amount of, your double blind, random controlled. You've got a certain general analysis of your experimental versus control, or whatever it may be that you're looking at. But the most effective information, or the most useful information, comes from the narrative for the individual case study and their story. So that is true. But for the purposes of changing the social structures, we have to see that disparity. But then we've got to do other research. So we've got to make sure the research becomes richer and much more to the individual. And I think that
people are actually, I was going to say, and that researchers are actually being intentional about recruiting diverse samples. I think a lot of times when we think about research studies, they're predominantly white. And I think that's another reason why some of the mistrust is existing within the Black community, because even the data we're using to make some of the decisions you're making about my care are not coming from necessarily a large sample and what we would consider to be appropriate amount of power, right? Like to really answer the specific question. So we're not, I think there's still, like, again, I think it's so important for people to find their lane. Like if you are a researcher, that's an example of a very clear way you can be more intentional.
Do some good research,
you do and be more inclusive.
That's fantastic. Oh, that's really good advice. Well, anything else that you both want
What she said too is just about, I think what you talked about with the college students is exactly what we see in therapy, right? That people have all of these, what we would identify as risk factors, but they may not think I need help. And part of that is that education, right? About what therapy how you can use therapy and when it can be useful and what indicators of therapy. But I think that for a lot of Black people, when you're used to enduring stressors or what is, what's normalized around you, and not saying for everybody, right? But just saying that when you're even going back to the whole strong Black woman, strong Black man, or being able to endure a lot of things, then you may not even look at it as this isn't normal, or this, I can seek help at this point. And so making it okay. It doesn't have to be this big catastrophic thing before you seek help, but that you can actually seek help when you're struggling in college, or you're having a
anytime,
or you just need a
everyone's
partner.
backing. Everyone's backing. You got to. I always say to everyone, listen, it's a human experience. Depression, all of us, anxiety. This is what we're all experiencing, but it's different in everyone's story, and we need to accept that. We need to make it. That I think that the problem, I see a big part of the problem is the narrative of saying that it's that it's a clinically diagnosed depression. It makes it sound so scary. So people, and then all the connotations that come with it. I mean, it's worse for the Black community than the white community, but it's bad enough for anyone with a mental health. Someone's having a breakdown, the police turn up. I mean, you're already having a breakdown, then it gets even worse. And how many times have we know the story, what happens in mental health, and the police situations being called in. That's got to change. Mental health requires compassion. If someone's depressed, it's not an it in their head jumping out. It is actually a story that person's got a story. There's something going on. They need compassion. They need social workers. They need psychologists. They're not police locking them up and making them even more fearful and stuff. We've got to change the whole narrative of mental health, and then it'll carry over to, and it shouldn't be just the narrative of mental health for Black people. It should be the narrative of mental health, because you've got to then stop making that distinction. It goes to your research point. We've got to be careful that we don't have like one set of rules for one and one set of humans have mental health issues. We have since the beginning of time. It's normal. Life is tough. And there's different experiences for each person. So let's just all accept we're all crazy and let's all help each other kind of thing. That sort of philosophy. I think we've got to change our philosophy so strongly in the world of mental health. Well, is there anything would you like to say, just in a closing statement, either of you'd like to make? I mean, this is only the beginning of a discussion. I think we need to have a lot more. I'd love to have you both back on again and take this discussion further as well. It would be amazing. But if there's something that you'd like to say.
Yeah, I just wanted to let everyone know about resources that we have available on our website. You can visit www.blackmentalwellness.com, and you will find a range of resources specific to specific mental health disorders, as well as general coping strategies specific to COVID. It's a plethora of resources. And, make sure to follow our social media pages, Black Mental Wellness, where we kind of do a more layperson's way of explaining certain things or connecting with people. We're currently in a Let's Just Be Honest campaign, which is all about how we use art to heal and how we use art to express. And we try to really model expression of art through our merchandise line, Authentically Me, where each of us have shared a personal story about why whatever the saying on our t-shirt, and you can visit our website to do that as well, really represents our personal journey with mental health and wellness, and just a piece of why we're so passionate about what we do. So if you can check out our website, we would love that. If you can support us in those ways, we would really appreciate that. Nicole, if you have anything to add, please feel free.
I mean, you summed it up so perfectly. Thank you for sharing your platform with us. I love it.
Of course. Of course.
The conversations that make change, and I really felt like we could talk and be really honest. We're sharing platforms just to be able to say, this is a different perspective, and it gives people a chance to listen, like we said, but that we can all come together and sort of think about, now, what do we do with this information? I think it's, think about culture, educate yourself, get resources, and then for the people, like, we all can benefit from therapy. It doesn't mean that you're crazy. It doesn't mean that something's wrong with you. It just means that you're a human having an experience.
Exactly.
That can help you. And the way I explain it to my patients all the time is like when you go to the doctor and they say, oh, you have high blood pressure, your doctor is going to come up with, these are the things I want you to do. These are the foods I want you to eat. This is what I want you to exercise. Here are your meds. In that same way that you come in, we're regular people. Yeah. We're going to listen to you, and then you will be able to think about what are the things that's going to help me deal with where I am right now. So I just want to normalize it as much. I love it. Possible.
Absolutely. Yeah. We all need the help. It's a normal part of humanity, and therapy is an incredible tool to help process the challenges of life. So it's something we all need. And there was a study that Yale brought out in 2018, which says there is no normal brain, which is such a great study. I love that title because it just shows that we're all in the same space in terms of battling with the differences in life. And where we see an issue like currently, there is this issue that we have to finally address properly with Black Lives Matter. We can talk, it's all combined together to contribute to the health of society as a whole. Thank you. We're going to put all those links in the show notes. Your webpage is lovely. All those things that you're doing are great. I recommend everyone go have a look at that and follow these ladies on Instagram. They're doing such a great job, and we'll put the links in the show notes. And thank you, Dr. Nicole and Dr. Daniel, for joining me. I'd love to have you guys back again to pick up and continue this conversation. It'd be amazing.
Absolutely. Thank you for having us.
Thank you both. Thanks so much. See you again. See you next time. Bye.
Okay. Bye.